Welcome back to Focus on Health, and like we said, we are having Dr. David Wairoto, who's taking us through anxiety.
Substances actually worsen anxiety. You may have anxiety, but substances will worsen it by 2 to 3 times. So as the doctor or the healthcare worker is treating you for anxiety, they'll also manage you for the substance use disorder. For us psychiatrists, and a psychiatrist, remember, is a doctor who has had additional training in mental health, and a doctor is someone who can prescribe medication for you. For us, we give medicine, and our main medication we give is a specific kind of medicine to boost some brain neurotransmitters. So we believe that someone has what we call a chemical imbalance or low levels of particular neurotransmitters. I may not mention them because it may be too complicated for the viewers, but our medicines boost or increase the levels of the neurotransmitters in the brain, and by doing that, the patient feels better, they're able to be less anxious, they have less panic attacks, and they also leave their homes. So with the medicine, we'll give you for 2 to 3 months, and then you'll continue with psychotherapy for an additional 3 months. But within 6 months, the outcome is good and someone is cured, is better. They're actually cured from the anxiety. So a psychologist is extremely important because remember, the medicines are step 1, or what we call stage 1 of treatment. The psychotherapy is step 2, and when we mean step 2, this is an individual who will help you deal with the triggers. Remember, in mental health, these triggers or stressors are the ones which actually predispose you to develop the mental illness. So when the psychotherapist comes in, they'll start with something called interpersonal therapy, what we call talk therapy. They will help you deal with the stressor. They'll understand your situation or scenario. Number 2, they'll formulate an individual therapy plan. And for most kinds of anxiety disorder, our main treatment plan is something we call cognitive behavior therapy, what we call CBT. And CBT is done by a trained psychotherapist who has competence or additional training in that kind of work. With therapy, Joy, the outcome is good, and we have a 95 to 99% cure rate. So psychotherapy or seeing a therapist is extremely important. So the first thing we tell our patients is share your story. So don't keep things to yourself. Remember, guys, we've said anxiety disorder is the most common mental illness. Some studies show that 33% of us in the world will at one time get anxiety. So if you do your math, you can see how many people in the world, over 300 million people in the world at one time will get anxiety. The second thing about sharing your story is also seek care. Remember, the earlier you seek care of a professional, the better outcome. Remember, when you have your flu or your simple tonsillitis, you're having throat pain, you're not feeding properly, you'll seek care immediately. The same way with a mental health disorder such as anxiety, I would advise you to seek care immediately. The third way I would tell young people is, and the KU fraternity, is exercise. Let us exercise. The American Heart Association encourages us to do 150 minutes of moderate intensity exercise every week. So by doing that, it is extremely supportive. Number 4, if you have a feeling that you are religious or you believe in a religious fraternity, I would tell you to go pray. Go see your Muslim person, go see your sheikh, go see you're at the temple, go to the father, share your story with these religious leaders, and of course take care of your health as much as possible. Unfortunately, for some individuals, it is not preventable. You already have genetic predisposition. You may grow up in a trauma area. You can imagine our brothers and sisters who are in Gaza currently, or Ukraine, which is currently a war zone, or DRC. These are individuals who are predisposed to trauma. Okay, so for some individuals, unfortunately, they're predisposed. But for many of us, if you are able to have good self-awareness by watching this TV show, checking yourself using those online tools, you'll be able to actually prevent yourself from developing anxiety. Well, I have seen a patient, I won't say their name, of course, because of confidentiality and privacy reasons. This individual developed severe anxiety when working in a law firm. She was a senior lawyer in a specific law firm, which was paying her extremely well. But for this individual, the pressure and the stress which we came with this workforce and her workplace actually made her develop anxiety. We treated the anxiety, but we actually came up with a good plan with our psychologist that she had to change jobs. So she changed job to a much slower job, which didn't have a lot of requirements. We also instituted an intensive exercise regimen for her. She went to church more often. She had more social support. And as a result, this is a patient who has been cured or gotten better of anxiety. Remember, viewers, anxiety is curable and treatable with very good outcomes. Remember, this is a disease which commonly occurs. So as mental health workers, we are well trained and well equipped to handle anxiety until we get you better. And remember, the earlier you seek care, the faster we treat you. Yeah, okay. So for some people, they believe that anxiety is something which someone has been cursed. Perhaps they've had some bad luck which has come to your life, which has made you become worried or made you change your behavior. But remember, guys, with any mental disorder, it's a disorder which can develop in anybody. It doesn't matter whether you grew up in perhaps Lavington, whether you grew up in a rural village in Kenya, whether you grew outside Kenya. Mental disorders do not choose anybody. These are diseases which happen to anybody. And remember, the treatment is well adhered to, and with good support, you'll get 100% curation. So I'd encourage the viewers, please seek the care of a trained support person, either a healthcare worker or even a normal doctor. Even your nurse in your health center has been trained to manage and treat anxiety. Remember, most anxiety disorders don't end up at the desk of a psychiatrist. Most of them are found in primary health care, and those are dispensaries, health centers, and level 2 and 3 hospitals. So my parting shots on anxiety is: 1, anxiety is extremely common. Number 2, let's learn how to talk to one another and share. When you feel you are going through a stressful life event and you are overwhelmed, please seek out even your classmate, your colleague, seek out your family, your spouse, seek out even your religious leader. When this anxiety becomes extremely severe, you are not able to leave your home, you worry about very many things, go online and search for Generalized Anxiety Disorder number 7 questionnaire. It is available, it is free. Fill in that tool. With that tool, you'll be able to get some instant results. Using those instant results, the tool will tell you whether you have mild anxiety, moderate anxiety, severe anxiety, and using those now results, you can be able now to seek the care of a mental health worker. Remember, anxiety is easily treated. We know how to treat it extremely well. The only thing I'd recommend to viewers is please share your story and don't also suffer in silence. There is care, and the care is available if you seek it. Thank you.
Just like Daktari has said, anxiety is manageable. I have been your host, Joy Bofenda, and until next time, stay safe, stay healthy. I'll live with the Healthy You segment.